Sponsored by Regeneron and Sanofi.
I would describe Olivia as tough and strong, considering what she's been through. She's had to deal with severe eczema, and she's persevered through a lot.
Growing up, eczema definitely shaped me into being tough. I felt like kids who didn't have eczema had it so easy.
We first started noticing eczema at around 6 months old, and she had red spots on her face and her arms. When she was 4 and 5 years old, it really started flaring up.
I was always so itchy. I had scratched so much that I'd bleed and have open sores. It was terrible. I had red patches and rashes on my wrists, on my ankles, my knees, the inside of my elbows, outside my elbows, my face, my neck.
For years, her mom and I were so frustrated because we couldn't figure out what was triggering her eczema or how to manage it. We went to so many different doctors and dermatologists and tried to get to the bottom of it. We put her on so many different types of diets. We did bleach baths, oatmeal baths, wet pajamas. Nothing we tried was getting her eczema under control. Every dermatologist we went to was prescribing topical steroids, creams. They would temporarily help, but it was just kind of like patching the ceiling and not fixing the leak.
Heat and humidity were big problems for my skin, and that's hard to avoid because we live in Florida. When I went to the beach and I went in the water, the salt water would irritate my skin because of the open sores on my ankles and the backs of my knees. So I just watched my friends all be in the ocean water and I'd just be sitting on the sand on a towel.
The itching made her very irritable. Her skin was so uncomfortable that it was bothering her no matter what she was doing.
The other kids would ask questions like, why is your skin so red? People thought it was contagious, so they didn't want to be around me. I felt like there was the only kid in the whole entire world who had eczema this severe.
It was just difficult watching her go through this as a child. We felt powerless and helpless after years and years and years. We were ready to do anything to help her find some relief. Then her doctor mentioned that DUPIXENT was just approved to treat moderate to severe eczema in kids her age. She said that DUPIXENT is a biologic treatment that targets a source of underlying inflammation that may be causing her eczema. And we wanted to move ahead with it. We trusted our dermatologist. It was different from certainly from a lot of the treatments we were trying. We agreed to try it. Before Olivia started DUPIXENT, I talked with her doctor about all the medical conditions she had and medications she was taking.
Make sure you talk to your doctor about the potential benefits and risks of treatment, including the most common side effects, such as injection site reactions, and some serious side effects, such as allergic reactions, including skin reactions that can sometimes be severe, eye problems, psoriasis, and joint aches and pain.
I remember my skin improving. I was just like, oh my gosh, I'm not like itching as much as I used to. It was like those birthday candles I wished on came true. I'll never forget what it was like to go to the beach for the first time once my eczema was more controlled. I first went with my toes, then my ankles, then my knees. The water did not irritate my skin like it used to. I never knew I loved the ocean so much. On hot and humid days, I still get some redness and some rashes, but not nearly as bad as it was before I started DUPIXENT.
I know everyone's experience with DUPIXENT may be different, but Olivia's results have been really positive. I just love how Olivia is worrying less about her eczema now because she knows it's more controlled. She's falling in love with sports, martial arts. She's gotten into basketball. She's a goalie in soccer. These are all things that she avoided doing when she had all those flares. She's phenomenal. I mean, she's really something special. I love watching her.
I just want to say to all the other kids like me, you're not the only kid in the world with severe eczema.
Important safety information. Do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic Helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT. are pregnant or plan to become pregnant. It is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. Are breastfeeding or plan to breastfeed. It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, or if you have AD and asthma and use an asthma medicine. Do not change or stop your other medicines, including corticosteroid medicine or other asthma medicine, without talking to your healthcare provider. This may cause other symptoms that were controlled by those medicines to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions, including skin reactions, that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, skin rash, including rash that looks like a bullseye, or painful red or blue bumps under the skin, general ill feeling, itching, swollen lymph nodes, nausea or vomiting, joint pain, or cramps in your stomach area. Eye problems. Tell your healthcare provider right away if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. Your healthcare provider may send you to an ophthalmologist for an eye exam if needed. Psoriasis. This can happen in people with atopic dermatitis who receive DUPIXENT. Tell your healthcare provider about any new skin symptoms. Your healthcare provider may send you to a dermatologist for an examination if needed. Joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects in patients with eczema include injection site reactions, eye problems, including eye and eyelid inflammation, redness, swelling, itching, eye infection, dry eye, and blurred vision, cold sores in your mouth or on your lips, and high count of a certain white blood cell, eosinophilia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended DUPIXENT be administered by or under supervision of an adult. In children 6 months to less than 12 years of age, DUPIXENT should be given by a caregiver. Please see accompanying full prescribing information, including patient information.